During the post-cabinet briefing on Tuesday, September the 14th, it was stated that some of the patients that arrive at the general hospital for emergency treatment due to COVID-19 and any complications that may come up, they were unaware that they had any comorbidities. And one of the suggestions that was given by the doctors there, it's important for Grenadians to get an annual checkup and to get labs. Can you tell us what is entailed in an annual checkup and unpack what it means by labs and blood work?
Before I get into that, one of the things that I have a problem with is communication. And I think our communication methods have been way off when it comes to talking to people about this pandemic that we have. So when we use terms like comorbidities, that's just Greek, Latin, and French to everybody. Nobody understands what we mean. Underlying illnesses. That's what we mean. Comorbidities means any form of underlying illness. Do you have diabetes that you're unaware of? Do you have hypertension that you're unaware of? Do you have lupus that you're never aware of? Could you just be on the verge of having some sort of blood cancer, like a leukemia or lymphoma, that sort of thing? And, you never know these things until you crash. And then all of a sudden you rush to hospital and say, oh my God, my pressure is high, or my blood sugars are high, or my white cell count has gone through the roof for whatever reason, et cetera, et cetera. So what they meant by having annual medicals done is like once a year. And I like to tell my patients that you want to do it around some significant event, like your birthday. Everybody remembers their birthday. So around about your birthday or your birth month, you make a plan to go and see the doctor. The doctor checks your blood pressure, and the most important thing is a simple history. How are you feeling? Do you have any concerns? How has your health been throughout the year? And so on and so forth. Because you have to have good communication with your patient for your patient to be able to tell you what is wrong with them. Because the patient will always tell you what is wrong with them. The doctor has to be able to winkle this information out of you, and you got to be comfortable enough to talk to the doctor to tell you what's going on, okay, from your sexual health to your belly aches and your diarrhea, etc. Okay, all of these things are very important. So once you've done that and you ascertain what's going on and you have an idea of family history, for instance, that your mother, grandmother, father, whatever, have high blood pressure, diabetes, because these are two big things that we deal with here in the Caribbean. Then we go to doing the testing. So when we talk about blood work, we need to look at things like your red and white blood cell counts. Simple English, is your blood weak? Do you need iron? Are you lacking in iron? Your white blood cell counts, which your white blood cells fight bacteria and viruses, and that's your immune system. That's your defense against ailments. Where is that? So we take a look at those things. We look at your blood sugars, okay? The simple blood sugar, where you look at your fasting blood sugar, which is at that moment in time, or you look at your hemoglobin A1C, which is this fancy test that we do that tells you what your blood sugar has been like over the last 3 months. We look at your kidney function. We look at your liver. We look at your cholesterols, okay? These are the main things. You can also, depending on what the person tells you when you're having your interview, look at thyroids, more and more checking your thyroid, which is that gland in your neck that controls how fast or slow your body moves and basically controls everything, right? That's becoming more of a regular thing because we're finding more and more that people's thyroid function is a little bit off. So that's another thing that we tend to look at, and that encapsulates the blood works, okay? Mm-hmm. We look at different systems in your body to find out what's going on. Of course, we check your blood pressure, and we have that. We're supposed to have that discussion where you try to educate people about your blood pressure. Blood pressure does this all day long, up and down. It's labile. So when you explain to people and try and educate them about health a little bit more, that encapsulates your annual medical that you're supposed to be doing, so you know where you are.
This is Rosin Douglas with Central Health Grenada. Please like and subscribe. Take care.